Hello, I'm here to tell you about a drug called dextromethorphan. What is dextromethorphan and what is it used for? Dextromethorphan can be found in Benylin DME, Buckley's, Dimetapp DM, Robitussin DM, and Vicks. It is an antitussive, non-opioid drug used for cough suppression. It arrests the cough reflex when the cough is non-productive or harmful. Its purpose is to remove potentially harmful foreign substances and excessive excretions from the respiratory tract. How does it work? It suppresses the cough through direct action in the central nervous system, specifically the medulla. It has a drying effect of the mucosa of the respiratory tract, therefore increasing the viscosity of the respiratory secretions, reducing symptoms such as runny nose and postnasal drip. How does the body process the drug? Dextromethorphan is metabolized in the liver and excreted via the kidneys. How long will it stay in the body for? The onset is 15 to 30 minutes, and the duration is 3 to 6 hours. The peak and half-life are unknown. How much would be prescribed for an adult? Adults and children over 12 years old should take 10 to 20 milligrams every 4 hours or 30 milligrams every 6 to 8 hours, with a maximum dose of 120 milligrams per day. What about me? How much should I take? Children 6 to 12 years old should take 5 to 10 milligrams every 4 hours to a maximum of 30 milligrams per day. Children 4 to 6 years old should take 2.5 to 7 milligrams every 4 to 8 hours to a maximum of 60 milligrams per day. Children 2 to 4 years old should take 2.5 to 5 milligrams every 4 hours or 7.5 milligrams every 6 to 8 hours to a maximum of 30 milligrams per day. How should dextromethorphan be taken? Dextromethorphan is available in a liquid or syrup, which should be shaken well and taken using a calibrated measuring device. Gel caps and caplets, which should be swallowed with liquid, and chew tabs, which should be chewed well. What are the side effects? People taking dextromethorphan may experience dizziness, drowsiness, confusion, ataxia, fatigue, and nausea. Can I take my other medications while taking dextromethorphan? There are very few drug interactions with dextromethorphan. However, it may potentiate the serotonergic effects of MAOIs. It also may increase adverse reactions with amiodarone, quinidine, serotonin receptor agonists, sibutramine, and SSRIs. Are there any contraindications to this drug? Contraindications for dextromethorphan include drug allergy, asthma or emphysema, persistent headache, hyperthyroidism, advanced heart and vessel disease, hypertension, glaucoma, having taken MAIOs within the past 14 days, after surgery for hernia repair, or in cases of non-productive cough or dry cough. Can I take it if I'm pregnant? Dextromethorphan should not be taken until risks to the fetus are considered. It is considered a Class C drug, which means that there are no human studies available, but animal studies have shown adverse reactions. As a nurse, what must I consider when giving this drug to my clients? Nurses need to assess cough type, frequency, and character, including sputum, and increase fluids to liquefy secretions. Evaluate the therapeutic response to the medication, which would be the absence of cough. It is important for the nurse to teach the client to avoid alcohol and CNS depressants, avoid smoking, smoke-filled rooms, perfumes, dust, environmental pollutants, and cleaners that increase cough. Notify physician if cough persists for more than 7 days. Is there anything else that I should know about dextromethorphan? Dextromethorphan is widely used because it is safe and non-addictive and does not cause respiratory or CNS depression. It will not treat a cough caused by smoking, asthma, or emphysema. Artificially sweetened liquid forms of cough medicine may contain phenylalanine, which is important to know if someone has phenylketonuria or PKU. Be sure to check ingredients and warnings on medications.